Okay, hello everyone. My name is Sandra Alexander, and I am the project manager for Circular Clinical Care, which is a project by the Canadian Coalition for Green Healthcare being undertaken with the financial support of Environment and Climate Change Canada. And on behalf of the team, I would like to welcome you to our second webinar for Plastics Reduction Week, focused on opportunities to reduce single-use plastic waste in food-related services. We're very grateful to have such a diverse audience representing various hospital departments and across numerous countries here with us today, as it really highlights the interdisciplinary commitment to collaboratively reducing plastic waste in healthcare. Food-related services is often one of the areas that generate some of the highest amounts of waste in healthcare. And while our team does acknowledge that plastics play an important role in patient safety and infection control, we also do believe that there are various opportunities to promote a circular economy and more resilient supply chains without compromising quality of patient care. So during this webinar, we will be exploring the exponential growth of single-use plastic waste generated by the healthcare sector generally, which led to the launch of the Circular Clinical Care Single-Use Plastics Reduction Project. We will explore planetary health work with the Director of Planetary Health, Amy Ford, from Nourish, and then we will explore more local strategies being done by the Hamilton Family Health Team by Lisa Zervera. And then my research associate, Tipu Islam, will be presenting a menu of actionable and high impact projects that if anyone is interested in piloting at their site, our project team is ready to help you undertake that initiative. So with that, we're excited to dive into these solutions with you, and we encourage your questions and ideas throughout the session, using the chat and the Q&A function. So with that, let's get started by defining what plastic is. So the sheer magnitude of the synthetic materials in the healthcare sector is genuinely outstanding. Why? Because plastic is just such a broad umbrella term that covers a diversity of materials. It covers the polymer composition of what plastic is allows them to be malleable and versatile. And as we know in healthcare, versatility is incredibly valuable. And plastics offer that. They are materials that can be shaped, they can be sterilized, and they can be used safely across a vast range of clinical tasks. Plus, plastic itself is a low-cost material. And with healthcare systems across the country feeling overwhelmed, often due to limited budgets, but a growing number of needs, plastic is a highly attractive option. And the effect of all of this is compounded when we actually look at the history of clinical practice, the way procedures have always been done. One-time plastic use is embedded into behavior because it's often associated with sterility. And that association itself can be accredited, at least to some degree, as to why the healthcare sector uses more virgin plastics than any other sector. So when we look at where does plastic exist in healthcare, they are virtually everywhere, from packaging to devices to the items that are worn, like PPE, to some specialized coatings of pills that patients take. Even the acrylic or the latex-based paint on the walls of a hospital can contain plastic. And so the list goes on and on. And so by correlation, the plastic waste just keeps piling and piling. It has piled up to the point where in 2023, across Europe and North America, there was a total system emissions of 9.3 million tons of carbon dioxide equivalent just from single-use healthcare plastic. And Eunomia and System IQ just released a report this year titled A Prescription for Change. And this report is the first of its kind exploring the global depth of this problem and really focuses on advancing the circular economy by providing a roadmap of evidence-based strategies. And the reason why this report specifically has become such a prominent part of the conversation and so quickly is because they project that without urgent action, hospitals across Canada and the US could reach 3.6 million tons of CO2e per year in 2040. And in 2040, the hospital systems could be facing up to $37 billion each year in plastic waste management costs, which is a 28% increase over today's expenses. So not only is this costing the environment, but it is costing a significant amount of money that could be diverted to providing direct patient care or infrastructure support. And the costs are continuing to rise because the environmental output is actively accelerating global carbon pricing, which then requires tighter climate regulations. And for transparency, the Circular Clinical Care Project Advisor and myself, the project manager, are listed as contributors to this report as we provided some insight into the Canadian landscape using data from previous and this current Canadian Coalition for Green Healthcare project. And this message could be further reinforced through the Lancet that has published papers this year with the same message that single-use plastic waste in healthcare is a topic of urgent concern, continuously highlighting that plastic pollution is caused by human activity and that the human health risks at every stage of the plastic's life cycle it needs to be considered. And that is why matter matters, because less than 10% of this matter is actually recycled. And essentially, all of the actionable steps and future research recommendations go back to the need for an interdisciplinary collective response. And in 2020, a report from the University of British Columbia gave a general estimate that plastics account for approximately 30% of all waste in Canadian healthcare systems. And so this further emphasizes a need for a change. And when we zoom in onto now like the actual plastic and observe the chemicals of concern, there are over 13,000 monomers and more than 3,000 of them are a concern to human health, according to the United Nations Environmental Program. And these chemicals of concern translate into the medical devices that we have that are directly used to provide patient care or to treat medical conditions, like using things such as implanted devices. When we look at the Canadian context, whether plastic is directly introduced into the body system or not, microplastics and nanoplastics will find their way in. They have been found throughout the human body, and we are starting to learn more that they can actually cross the placenta or the blood-brain barrier. And basically, they are starting to influence all of the major physiological systems. Food and water have been thought to be the main exposure path, but new research highlights that they could also just be inhaled, specifically from air pollution. And so research has shown that we inhale up to 68,000 plastic particles per day, which equates to the average person having about 7 grams of microplastics in their body. So when we multiply 7 grams by the Canada's population, which was estimated to be 41.4 million people on October 1st, 2024, the math shows us that the human bodies of people living in Canada are essentially vessels that are carrying a combined weight of 290,000 kilograms of microplastics. And so that is why we need to take action. And recognizing that problem led to the launch of the Circular Clinical Care Project. And so this is a 3-year project being undertaken with the financial support of Environment and Climate Change Canada. And to summarize the project in just a few words, I would say we are an interdisciplinary team committed to sustainably reducing single-use plastic waste in healthcare across 4 areas that we have identified as hotspots. And so these 4 areas correlate to the themes of Plastics Reduction Week, which we are exploring every day this week. And we have 3 partners. Our pilot partner is Hamilton Health Sciences, which is a network of hospitals in Hamilton, Ontario, Canada. And it is the only hospital system in Ontario that cares for all ages from pre-birth to end of life. And they are a world-renowned hospital for healthcare research, which is correlated to their collaborative relationship with McMaster University, especially with the School of Medicine, which is a full project-long partner of the Circular Clinical Care Initiative. Within the School of Medicine, we have partnered with McMaster University's postgraduate medical education, which is a program where our executive director, Dr. Sargent, leads the sustainability stream, and we collaborate with medical residents. Just for clarity, a resident has their medical degrees, so they are doctors, but now they are training into their specialty. And so we collaborate with the residents to implement quality improvement projects. And we also have a relationship with Peach Health Ontario, which is a collaborative group based at McMaster University, but their work spans across Ontario, and they specifically support our knowledge translation work. And so at this point, we are 12 months into the project, and we are starting to transition to a national campaign. Now, when we look at our specific food-related services category, our repository currently holds 30 plastic items that are commonly found related to hospital food services. But we have almost just as many ideas for actual projects because what we eat plays a massive role in our carbon footprint. And so on the screen, I have included a graph that shows animal-based foods have a considerably larger carbon footprint. And when we consider a hospital, for a medium hospital with about 200 beds, that's 200 inpatients that are receiving at least 1 meal a day, if not 3. And so those meals, at least one of them includes protein. And if that protein is all plant-based, half of this top bar is now gone. And that is just one switch and how impactful it could be. So I'm very thrilled to now introduce Nourish's Director of Planetary Health, Amy Ford, to explore the work her team does at a national level to reduce waste in food-related services across the country.
Thank you, Sandra. So hello, everyone. As Sandra mentioned, my name is Amy Ford. I work at Nourish, and at Nourish, we work with healthcare leaders across Canada to harness the power of food, ultimately to better the health of people and the planet. And I'm here today because, as was mentioned, hospital food services can be a real hotspot for plastics, for packaging, for waste. And so I wanted to outline some of the alternatives that we've seen work. And I wonder, I just have a curiosity about what type of people join a call like this. It's a great attendance. And if it's possible to put something in the chat, which Sandra, come off mute if it's not. Just curious if you work primarily with food, like food services, nutrition, dietetics, or if you work primarily in sustainability or a secret third thing. So I'd love to just see where everyone's joining, what type of role. So as we've heard, healthcare food services generates a lot of plastic every day. That can be from plates, bowls, and cutlery to wrappers, supplement bottles, and individual condiments. So this photo was taken in Canada. I think you can tell from the Bruce, which is like a Canadian-made cold coffee protein product. And it was at a hospital. I actually don't know which one, but in Ontario. And just from looking at this meal, you can see even with a modest patient count, a dinner like this is going to fill up the waste bins and go to landfill. And hospitals have to pay twice for this. So there's packaging coming in and then the waste going out. It is a really important thing for our planet, and it's also important for the patient experience and for the bottom line that we take a look at this and make some changes, find some ways to improve. Doing a waste audit can really be eye-opening for a hospital team to realize how much they're sending to landfill and what of those things could be reduced or be diverted. So when hospitals are ready to tackle this big challenge of plastic and packaging reduction, it's important to take a good hard look at the menu, their procurement processes, their equipment, the staff training, and their overall operations. There's a lot to look at, but it's so worth it. And I want to explain that through a case example. So let's start at the very beginning. One of the hospitals we work with began by recognizing this issue of waste, and they identified a list of goals, and one of them was to reduce food waste, and another was to reduce packaging waste. So this meant they had to audit everything that was going to landfill. They found a lot of food was left in pans after they'd portioned it out. A lot of food was coming back on the patient plates after they'd eaten. There was production waste, things like even just wrappers and bags from what they unpacked from the orders. And there were things left on the tray like single-use condiment packages, a ketchup, be it used or not used. So from all of the projects that they thought might be able to improve the situation, they put them on an impact effort grid. And this kind of shows what is doable within the capacity we have that could be considered a big win and that could move the meter. And so that's how they decided what to do first. Their first project was eliminating the use of plastic straws. This felt like an easy place to start because the majority of straws that were sent to the patient rooms weren't even used. They determined that every month a really significant number of straws were sent and then returned untouched, but they weren't able to be used again. Through engagement with their clinical team, it was determined that some patients really do need a straw, such as in the case of a serious neck injury. And so removing them from stock completely wasn't going to be possible. That said, they could turn straws off by default, and that would mean that only patients who truly require them for clinical reasons would have them coded into their file, much like you would code a supplement or double portions. And then the straws that did need to be purchased, which was a far lower number, were moved to an eco-friendly alternative. And this led to a pretty great cost savings right away. On the tails of that big win with straws reduction was something just outside the kitchen in the dish room. And these are called shoe booties. So it's an elastic banded plastic covering that goes over your footwear, and it's designed to reduce water damage for staff shoes and also reduce the risk of trip and fall. And they get thrown away with every use. This team identified there was a reusable option that could be assigned to one person and used for 6 months at a time. This change required lots of engagement with the staff using them to make sure they understood why and that they were on board with this. But the swap led to a huge reduction in plastic waste for their operation and over $10,000 in savings every year. Next to tackle was this classic plastic sandwich wedge. So this has been a staple because dietary aides can prep sandwiches in advance, they can individually package them, and then they stay fresh for a few days and they're easy to access. You can look at what's inside. But there's something else you can use, which is a reusable plastic dome, and you can just place it over the food on the plate. So to them, this seemed like a great alternative to something disposable. And they sourced the product and reviewed the cost implications. And then they also had to look at, okay, which staff are going to wash them? Where are we going to store these in the kitchen? What training do the staff need? Because not only do they have to change how things are put on the tray on tray line, but they also have to change how the sandwiches are prepped, whatever day of or a few days before. So now they prep sandwiches and put them into a metal insert right into the fridge. And this has cut down on waste a lot, several thousands of pieces of plastic to landfill every year. So many other changes followed. They tried not putting lids on cupped items where appropriate. They started using reusable dishes instead of plastic ones for some foods. Ultimately, what led to their success was creating a new normal where food items were assessed before they were added to the menu and were plated with the least climate intense option. So it just became like their status quo. Some other things that led to their success, they had very strong change management techniques, so making sure that the staff understood why and were part of the process. They were willing to do things that were out of the norm, so rearrange the kitchen, change their usual practices, and they use detailed tracking to review the impacts later on. And this is handy for reporting up to senior leadership or being able to put it in a newsletter so people know the great work you're doing. They noted later that while planetary health was the primary motivator for the changes, there were actually two other amazing benefits to this. A better patient experience because they were eating from reusable, like home-like items instead of disposable, which feels very institutional. And it was also more accessible because many lids and containers are challenging to open if you have poor hand strength. And so these ones were much more accessible. Hospital food services can find opportunities at the procurement phase, so favoring a contract for a big family style pizza that's directly in cardboard versus individual pizzas that are each wrapped and then wrapped again in a set, and then maybe the box is wrapped too. Just looking at opportunities there. Certainly moving toward in-house production and from scratch cooking using whole ingredients is a big win. And before awarding contracts to suppliers, asking them questions about what is your commitment to sustainability? Is there something creative we could do that would be a win for everyone? Like delivering in reusable crates that we switch out versus delivering in things that get thrown away. Sometimes items go in the trash that could have been diverted. So, one example is if food is perfectly good and safe, but you can't put it back into circulation for patients because of infection control protocols, you could potentially donate it. So, there's great groups like Second Harvest that make sure food goes to someone in need. If it's organic material like leftover food, you can compost it. And that could range from give it to a local farmer so they can feed it to their pigs, to opt into the municipal green bin program if that's possible, to sell it to a contract company that uses it to create energy. Of course, if it's recyclable, do that instead of throwing it in the garbage. And lastly, if it truly needs to go to landfill, then make a note of it so you actually know what things you need to tackle in the future, and you can stepwise try to reduce the amount that's being wasted. Just another quick option, swapping single-use condiments for bulk portioned condiments. It's a big win for the bottom line and for the patient experience and drastically reduces plastic. Also consider how much you're sending these things by default. So if you've not asked a patient for preference, they're probably going to get a cream and sugar with their coffee every day and a ketchup mustard relish with every burger they're served. I drink black coffee and I don't like ketchup. So there's probably lots of patients out there that are getting that all the time, and you could just not send it by asking for preferences. Don't send single serve things by default, cuts down on unnecessary waste by a lot. And I'll just close by saying this type of transformation happens best when you're working in community. So we have a community of practice where hospitals share and scale solutions. If your team wants to look at ways to cut food waste, packaging waste, we'd love to connect you with peers, pilot ideas, and share what works. I think together we can make a healthcare system that centers food for a circular healing system. Thanks so much. And I think I'm going to pass it over to Lisa, if that's right.
Thanks, Amy, and thank you, Sandra and Tipu. So I'm just gonna share my slides here. Is this visible?
Looks good.
Yes.
Yes.
Okay, awesome. Thank you. Great. So my name is Lisa. I'm a second year PhD student at McMaster University, and I'm really excited to share some of the research that I'm doing for my PhD, and in particular, implementing a food prescription program into primary care in Hamilton, Ontario. Special thank you to my PhD supervisors, Dr. Kandasamy and Dr. D'Souza, and my committee members who have supported this project. So before jumping into the food prescription program, I want to ground us in a bit of literature regarding why exploring food systems and plastic waste used in food systems is so important from a global perspective. Oh, is there? Okay. So this is a graph identifying planetary health boundaries, which are the limits on Earth systems. And if these boundaries are exceeded, then this could lead to irreversible and dangerous changes that could impact the way we live our day-to-day lives. The recent 2025 report suggested that we have transgressed 7 of the 9 of these boundaries, and actually, food systems are the major driver for the transgression of 5 of these boundaries. So let's delve into this a little bit. The 5 boundaries that the food systems have transgressed include freshwater change. We know that water is used for irrigation. This is one of the major uses of the blue water. There's also novel entities, which is the use of plastics, antibiotics for cattle and other animal sources of protein, and also the use of pesticides to kind of optimize the delivery and growth of these foods. We also have biogeochemical flows because in order to meet demand of people, we have some messed up phosphorus and nitrogen cycles in our world. And then we also have biosphere integrity with a decrease in genetic diversity due to the increased amount of single types of animals that are used for food in our world. And this is one of the most areas that has received the most media coverage, which is the area use. And so agricultural expansion mainly is the result of deforestation. So we see the Amazon rainforest being depleted due to the use of land for cattle and also for growing the food that then feeds the cattle to meet the demand of our communities for meat. Now, this is a graph that Sandra has shown earlier today, which demonstrates that beef actually has a significantly higher environmental impact than plant-rich sources of protein, which is why it's so important to discuss with your patients the kinds of food choices that they make. It's not only impactful to to their sustainability footprint, but also to their health. And so the Hamilton Family Health Team is a primary care team in Ontario that's created a couple of resources that are both patient-facing and physician-facing, and also clinician-facing, to inspire conversation about plant-rich eating due to the many health benefits that plant-rich eating can lead to, and also the sustainability impact that each patient can make. We also know that plant-based diets reduce heart disease risk by 40%, along with many other important risk factors. However, many patients can face different challenges in acquiring healthy whole food, one of which is food affordability. So we know that food bank use has increased significantly. We know that food prices, especially in rural areas, has increased significantly. And so how do healthcare providers, hospitals, and health teams support their patients in receiving healthy food? We know that food insecurity is a very complex topic, and food price increase is only one of those factors that can impact food insecurity in a population. This is a summary of the different types of factors that can impact, and just pointing you towards the individual and socio-cultural environment. We see food preference, socio-demographics, food literacy and preparation skills, language barriers, and sometimes cultural identity, acculturation, all having an impact on what a person eats. And so understanding the complexities can significantly improve the education that you deliver to your patients. And I see in the chat there's a lot of healthcare workers here, so I'll kind of frame it from that perspective as well. So if you live in Hamilton, then you've probably seen the Code Red report. This is a report that looked at different socio-demographic factors impacting population health in our area. And what it found is that there's a 21-year life expectancy difference between the red zone and the green zone. And just for context, right above the red zone is Hamilton Harbor, which is Lake Ontario, and also a lot of our steel industry. Hamilton is known as the Steel City because of the various factories that produce steel. And so there's a significant impact on population health. And the Hamilton Family Health Team has placed multiple clinics in that zone to improve access to primary care. We also know that food insecurity rates are actually higher in Hamilton than the provincial average, with 1 in 4 households affected by food insecurity in 2023, and the numbers have increased since then. And we have a few resources available for our communities, such as food pantries. So this is a picture of one food pantry in Hamilton. But as you can see from the image, we see lots of canned goods, we see lots of packaging, beans and things like that, and no fresh foods. And so this is something that needs to change. And something that we need to somehow embed into primary care to support people in acquiring those fresh goods. And primary care is a very great avenue for this because providers have the opportunity to form long-lasting and trusting relationships with the community and are able to deliver education to patients in a way that supports them and that they understand. However, sometimes there's a lack of resources. And so, wouldn't it be great to allow primary care to also, alongside the education, deliver some sort of tangible, feasible component that will allow people to purchase more fresh foods? And this brings us to the food as medicine concept, which was first established in the United States, but has been practiced in Canada, US, and in Europe, UK particularly, which outlines various types of programs that can deliver both treatment and preventative care um, in terms of food items to people. So, medically tailored meals is the most robust type of program. It's considered treatment and is often evaluated with a randomized controlled trial. What we are introducing into the Hamilton community is a produce prescription program. What a produce prescription program does is allows the clinician to identify a patient who has a chronic disease such as type 2 diabetes and is also living in food insecurity and gives them a voucher, which provides some additional funding to support the provision of healthy whole foods from a local store that is part of the program. And so, a key component for developing and designing a program like this is actually community-based participatory research. So, the project involves community stakeholders at every step of the research to ensure that we are meeting the needs of the community. And it's not just the community that we need to consider. We also need to ensure that the program fits into the clinical flow, which is why we will be involving providers within this research and also usable by program staff, which is why we will also be gaining feedback from food program delivery staff from across Hamilton. And so the plan for this project is to host a variety of focus groups discussions to inform the creation of the program. The program will be housed at the Eva Rothwell Center, which is a small community clinic that is attached to the Eva Rothwell Center, which is a community center for kids and serves the LA Del postal code region, which is right central in that code red zone. And so it's a very vibrant community which will support many patients who would greatly benefit from this kind of program. And also, we will be involving various stakeholders from across Hamilton. We do know that there is multiple food delivery programs available, such as this food prescription program from Compass Community Health. So we will be involving them in the design of the program to ensure that it kind of fits into the clinical and social context of the clinic. The flow of the program I briefly touched on, but basically patients are enrolled. They participate in a clinical visit where the provider gives them the prescription and also links them to a variety of resources such as cooking classes, such as we have a couple of other programs available through Eva Rothwell to kind of inform people on healthy eating and also how to prepare the food and what kind of infrastructure is needed. Participants are then able to redeem their vouchers at local participating vendors and then also attend monthly clinical visits to refill their food prescription and also, set new goals. We have multiple resources available at the Hamilton Family Health Team, such as this budget-friendly cooking class, which is available for everyone who is above 18 and basically just teaches individuals on how to cook those whole foods into delicious meals and enjoy the the foods. And this program also delivers vouchers. So integrating those various programs together can help the primary care system deliver a more wholesome intervention and support those people who would greatly benefit from additional support for eating healthy foods. So that's the update on the food prescription work in Hamilton, and I'll pass it on to Tipu.
Hello, everyone. It's such a pleasure to virtually meet you all. My name is Tipu, and I am a research associate at the Coalition. I have, an academic background in interdisciplinary science, clinical research, and global health. As part of my work, I primarily support with the development of business cases and case studies for the Circular Clinical Care Project. I also help to centralize ideas for circularity and plastics reduction that we come across, and there are many. And in this segment, I'm so excited to share a menu of 5 initiatives that reduce single-use plastics within healthcare food service. And we'll go through each of these ideas and highlight global examples of implementation across healthcare contexts. These range from pilot programs to theoretical rationales for pilots. If you have questions as we make our way through, please feel free to put them in the Q&A section. And if there's an idea that stands out to you and that you're interested in piloting at your facility, please reach out to us and we can explore potential ways to support you and your teams. Starting with reusable cutlery, this initiative makes reusables the default for dine-in meals provided in hospitals, whereby disposables are only provided when the meal is specified for takeout. An implementation example includes a hospital group under the NHS in the UK, which phased out all single-use plastics cutlery, plates, and cups since 2021. More broadly, across parts of Europe, we are seeing the viability of replacing plastics with reusables and non-plastic alternatives. Legislation in Canada has certainly helped catalyze a change away from plastic utensils in our facilities, though this initiative still has pilot potential because even wooden utensils are sometimes provided in plastic wrap. Another policy catalyzed change is highlighted in our next example from Europe, where they eliminated condiment sachets. According to sources, a recent European Union directive included a ban on condiment packets in food and cafeteria service sector holistically. The potential impact of this regulatory shift is especially prominent at Yorkshire Ambulance Service in the UK, where single-use plastic condiment sachets were replaced with larger refillable containers. This initiative was grouped within a larger effort, though we did see the elimination of these sachets affiliated with an overall reduction in plastic waste and costs. And this initiative was viable to implement and also shined on the feasibility front. Feasibility and viability are core pillars to our assessments when choosing to undertake initiatives, and they're still underway for this next initiative, but I wanted to share it with you because during a site visit at one of our pilot sites, I learned that hospital cafeterias use single-use plastic wrap and disposable plastic lids for products such as salads and yogurt. And as part of our research in seeking food packaging innovations, we identified 2 initiatives. First, we investigated the plastic wrap and came across a compostable film that was free of PFAS, per and polyfluoroalkyl substances. In alignment with our research and evidence-based approach, we are still evaluating the practicality of this initiative and identifying the process changes that may allow this to be implemented in a hospital's retail cafeteria, as well as researching life cycle analyses to see whether this film is actually compostable and how long it takes to biodegrade. Second, we investigated the containers themselves and found that there are Canadian full-service vendors that provide reusable containers for retail food service. We've been able to identify some that have worked with healthcare facilities in the past, providing containers, mugs, and they do all of the washing themselves. And so it isn't a capacity burden on the hospital's own cafeteria services. We continue to assess the viability of this compostable film and the feasibility of reusable containers. Here's an initiative where the numbers really get me excited. Through a scan of the grey literature, I came across a hospital in the UK, which made a series of changes to its catering services. They replaced paper and plastic cups with reusable mugs and brought back China coffee cups for staff dining. They also swapped out paper plates and cutlery for biodegradable alternatives and removed straws. And they also introduced both a latte levy, which is an additional charge and a discount for bringing a reusable mug. So framing the if you don't bring your mug, you are charged a levy as a way to motivate folks to bring their own reusable containers. And the impact was meaningful. A pre and post implementation assessment showed about a 77% reduction in cutlery consumption, a 43% reduction in plates, and a 66% reduction in cup use. They credited much of their success to staff engagement and training, which helped make these changes stick and become part of the culture. This was also showcased at the NHS Sustainability Day in March of 2019. And our final idea is one with global interest. Reusable water pitchers. In this initiative, inpatient services involves bringing reusable pitchers and cups in place of single-use plastic-containing disposables. We do have some implementation pilots and examples through discussions that we've had. They're not directly part of this project. Mainly, we found that concerns have stemmed from washing capacity, IPAC concerns, and internal logistics, such as those who brings the pitchers to the station where they need to be washed and how are they collected and tracked. Sites that have tried to implement this have communicated that cups tend to be more of a challenge than the pitchers themselves. And with that, I thank you so much for your time. Thank you for bearing with me. I'm a little under the weather today, and I'll pass it back to Sandra.